Welcome, everybody. This video is presented to you by Harvard Medical School. We want to start by thanking everybody within the Harvard community for bringing this webinar to you. Specifically, we want to thank the Dean's Office in Administrative Leadership, the Program in Graduate Education, the Office for External Education, the Office for Postgraduate Medical Education, and Human Resources. All those constituents from HMS have come together to help us manage anxiety in the middle of a pandemic. The coronavirus pandemic has changed our lives in significant ways. Prior to this pandemic, the World Health Organization showed us that 3% of the population in China experienced significant anxiety. Yet, since the resurgence of COVID-19, 23 to 35% of the population in China is experiencing significant anxiety. A virus that started in a single community has reached pandemic numbers and is affecting all of us globally. As we zoom into the United States of America, today, we have 50% of our students out of school, and that number is climbing every minute. Millions of Americans are asked to work from home. Millions more are in danger of losing their job, and many have already lost their job. Although there are no science or no research articles yet about the impact of coronavirus in our mental health, a Google Trend analysis shows us that in the last 90 days, there is a significant surge of Americans really trying to understand how to manage their anxiety through coronavirus. It's no wonder that many of us are having anxious thoughts, are really worried, and are feeling the biological anxiety related to coronavirus. Many in our community have reached out to us and have shared thoughts like, am I too worried? How do I get rid of my anxiety? How do I care for my children and work? The leadership at HMS came together to bring to you a series of webinars to answer some of those questions. We're going to be talking about regulating emotions and building resilience in the face of a pandemic. I'm Dr. Luana Marques. I'm Associate Professor at Harvard Medical School and Director of Community Psychiatry Pride at Mass General Hospital. In our research lab at Mass General, we work with under-resourced communities to teach them skills to help them handle anxiety and stress. And in this webinar series, we'll be working with you to share some of those skills based on scientific knowledge from cognitive behavioral therapy. Specifically, today we're going to zone in on the role of anxiety in the midst of a pandemic. How do we understand what's happening to our bodies when it's 3 a.m. and we can't sleep and we are on Google trying to understand how to manage anxiety? We'll be releasing a second webinar on very practical techniques to slow down our brain, to cool off, to get a handle on our fight or flight response. Many of us are cooped up at home and feeling the sense of, how do I remain connected with my loved ones? We'll talk about that, and we'll teach you how to charge up, how to help your immune system get as strong as possible in the midst of a pandemic. And because many of us, including myself, are having really catastrophic thoughts and are very anxious, we will spend a webinar also exploring what we are saying to ourselves, how it's affecting us, and is there more balanced ways for us to be able to manage anxiety and distorted thoughts in the midst of a pandemic. Before I move on, I want to invite one of my colleagues, Oren, who is going to be talking to us a little bit about his own anxiety today and helping us really think about ways to understand anxiety. Oren, welcome to our webinar. I'd love to hear how you're holding up in the past week or so.
Thanks a lot, Luana. Man, it has been quite a week. I think like a lot of people, one of the things that I'm wondering right now is is the level of anxiety that I'm experiencing, is it rational or is it overblown? Have I hit some kind of a tipping point? And how would I even know if I did?
Oren, those are great questions. And actually, a lot of my patients have reached out to ask similar questions. I think before we talked about that tipping point and is it normal or not normal, I think all of us have to anchor a little bit on biology. So let's just for a second, Oren, let's imagine that all of us are face to face with a lion, a real threat. Many of us have heard about this before. A real threat leads to a stress response. And what happens is our limbic system, our emotional part of our brain, gets activated. It's getting us ready to flee from that lion. It's getting us ready to survive. What actually happens here is that our body gets really activated. Our heart starts to pound. We get blood from our head to our extremity. We tense up. We may sweat. We notice that we have trouble focusing. Our body is ready to get us out of danger. All of those symptoms are also symptoms of anxiety. And they are, however, evolutionarily adaptive. So what I really want to bring home here is that in the face of a threat, many of us, all of us, in fact, should have a fight or flight response. And that is what has helped us survive up to now. And right now, COVID-19 is an actual threat. So in many ways, I think the first message I want to share with all of our listeners is that anxiety is biologically adaptive. And that really is wired to get us out of danger, signals something important to our bodies. And right now, we have a real threat. So all of us are going to be experiencing some level of anxiety because it's biologically adaptive.
So are you actually saying that some amount of anxiety is a good thing right now? Like it's somehow helping me prepare for the threat?
That's a great question, Oren. So, biologically, it is adaptive for us to have a stress response, a fight or flight. But I like to think about this as sort of a spectrum of anxiety a little bit. We know from science, the Yerkes-Dodson curve, the law that shows us that there is this inverse relationship between our ability to perform in life and our arousal, our anxiety. And this graph in front of all of us shows that. On the bottom left, you have low arousal and low performance. And what happens here on the left is when our brain is totally not on yet. So imagine this like getting up in the morning and not having the first cup of coffee yet. You're still feeling a little sleep. Your level of arousal is not on. Sometimes this can also indicate a little bit of fatigue or tiredness. But basically, we're not performing at our optimal level. When we move to the middle of that curve, that's where most of people talk about being in the zone. It is where our arousal is optimal and there is good performance. For example, at this moment in time, as I'm speaking to you, I'm excited to be sharing this message with you. And so my anxiety is in the zone here. It's really helping me stay focused so that I can share this information with you. However, Oren's question is, well, is there a tipping point? And the reality is, there is a tipping point. When anxiety becomes too much, what we see is a decrease in our ability to focus. We see that we can't really respond to threat too much. This is when my patients say, I'm paralyzed by anxiety. I don't know what to do. I can't focus.
Yeah, that makes a lot of sense. So just this spectrum of anxiety that we're all living on. But I guess I'm still not exactly sure how to know when I've reached that tipping point, like when it's no longer helpful and productive for me to worry so much. And if I do hit that point, what are the consequences?
Mm-hmm. Great questions, Oren. So it sounds like you really get the idea that anxiety has a range and too much is a problem. But really, what is that tipping point? Well, we know that anxiety affects a lot of what we're saying to ourselves. And we start to have a lot of anxious thoughts. So one of the indicators that anxiety may be too much is when you're sort of saying to yourself, am I prepared enough? I need to stock up. Really, how long will things be closed? You're starting to notice that your brain is no longer on sort of action. It's really sort of ruminating or worrying at a high level about anxiety. How am I going to take care of my children? So you're really in this position where your brain doesn't stop. It's going to get worse. And many of us, it's important to remember that we're going to have some of those thoughts. But the tipping point is when we can't really let those thoughts go, that our thinking is really driven by anxiety. Another indicator for all of us is our body. We feel that fight or flight response, and when it's on all the time, we feel tense, we feel tired, we feel sore. So really linking into your body and understanding what's going on here. An example that a patient of mine shared that I think really all of us can touch right now is if you're watching the news, the next thing you know, you notice your heart's pounding, right? That might be an indication that you are a little over that peak and it's a little too much. The other thing that many people have noticed right now is that not only anxiety affects what we're saying to ourselves and what we're feeling in our body, in our emotions, but also what we're doing. And many of us have spent countless hours glued to our phones, trying to get more information, glued to the news. And we're really sort of getting more and more activated because we can't let it go. We're feeling anxious and we're sort of behaviorally trying to seek more information. What's happening here, and it's really important for us to remember, is when we have those anxious thoughts, our body's on fight or flight, and then we manage some of that by gluing to the news, what's happening actually is that we're activating our fight or flight. So now we're actually, instead of helping ourselves, we're on a little too much. And that really gets us even closer, if not all the way, in that tipping point. Another point that I think is really important is that this heightened anxiety is really not just a mental health concern. It's certainly a mental health concern for many of our populations who already have some vulnerabilities, and for all of us who have a heightened state of anxiety now. But research really shows us that heightened state of anxiety for chronic amount of time actually hinders our immune system. We have heard over and over again since the beginning of this pandemic that a strong immune system is one way to fight coronavirus. So it's really important for us all together to really find a way to bring our anxiety back to that zone that I was talking about, so that we're not only helping our brain to cool off, but we're also helping our immune system.
Got it. All right. So like what I'm taking away from this is that like there are actual physical responses that I can pay attention to. And then also just my own thoughts, like the flooding of thoughts. And those are really indicators. It's like when I can't turn my brain off, or there's like I feel it in my body that I have hit that tipping point. Is there actually like a way to almost like take the temperature of your anxiety to know in a more concrete manner if you're in a zone that is actually unhealthy?
That's a great idea, Warren. And actually, I share a lot of that with my patients. The same way you go to a primary care doctor and, they take your temperature to make sure you don't have a fever. For our anxiety in general, there are evidence-based measures, questionnaires that have been validated worldwide. Here's an example of something called the GAD-7. I think about this measure as a way to take our anxiety temperature. Questions like, have you been feeling particularly nervous, anxious, or on edge? Have you been worrying too much about different things? The GAD-7 is the measure that was used on some of the studies coming out of China. It's been widely used on most of our studies here at Mass General and in the US and globally. And what I'm going to recommend is that most of us who are interested in this idea of like, well, am I over that peak of anxiety? Is it too high? That you go to our resource page and we'll put a link to the GAD-7. And that way you can sort of get a baseline of where your anxiety is right now. Now, there's a caveat to this, I think it's really important for our listeners, is that all of us, as we mentioned in this webinar, are a little elevated right now. So although you might notice that you're a little elevated, what's be interesting is to have a baseline of where you are right now. As we heard from our officials from the CDC and the WHO, we might be at this for a while. And by taking your temperature right now, you might be more informed to figure out when it is that you're really tipping that point and when it's time to reach for more resources. And here at HMS, we have a lot of resources available for our community. We'll provide in the resources page of this webinar, we'll have a link to that. But if you're not part of the HMS community and you're sitting at home at 3 in the morning, still feeling anxious, I highly recommend that you go to the website of the Anxiety and Depression Association of America. ADA is a association in the US that really is at the core of providing evidence-based knowledge to our consumers and has a lot of the experts on anxiety in our community that will help you navigate this. ADA also has a free community where you can sign up and actually engage with folks who may be experiencing similar level of anxiety as you are right now. And I suggest that because many of us might be cooped up at home, and finding social support in a time like this is crucial.
Got it. Thanks so much, Luana. It's great to have some way of actually taking the temperature of our emotions, and it sounds like this test is a good place to start. So besides these resources that you just shared and this self-diagnostic tool, like what else can someone like me do right now to manage my anxiety? Like for example, I am still just like spinning from the news that my kids are going to be out of school until at least the end of April, and maybe even longer than that. And that is like just overwhelming in so many different ways to me right now.
Warren, one of the techniques, I think all of us are there with you. Actually, it's just being home with our kids and figuring out how to manage our lives and continue to work and manage our kids. I think, of course, is creating some level of anxiety. One of the techniques that we talk about a lot that's evidence-based, something called cognitive behavioral therapy. And we call it CBT for short. And CBT is basically a way to use skills to help our brain stop spinning. What I was wondering, Aaron, is if we can use that example that you just shared, getting the news of your kids being home until at least the end of April, and demonstrate to our listeners a little bit of what I mean by CBT so that we can work through it together.
Yeah, let's do it.
So let's talk a little bit, I already got a little bit of the visual of the situation, but can you describe a little bit more where you were when you got the news and just walk me through like what happened to your brain? Just walk me through what was going on, Oren.
Yeah, I mean, I like remember I was like in my kitchen. I think like we were getting ready for dinner, and all of a sudden like my phone starts blowing up with like text messages from people like Boston Public Schools is closed. I look at the date. I like had to click, like look again. I couldn't even believe like April 27th. This is unbelievable. I'm then like, how am I going to get any of my work done? Like I'm, obviously anxious about already working from home and then structuring their day. I'm like, my kids are going to be overwhelmed by social media and cooped up in the house. Like it was just everything kind of flooded at once. And then just like breaking the news to them, I had a pit in my stomach. It was almost dinner time, and I didn't even know how I was going to share this with them in a way that like would help make them feel calm. But I wasn't feeling calm, so it was definitely a tough moment. I still don't feel like I fully recovered from it, to be honest.
Wow, Warren. Thanks for sharing. Absolutely. So let me slow us down a little bit though, because you just said so much. And CBT, one of the things that helps us do is sort of slow down our brain a little bit. So it sounds like if we anchor in the situation, I can see you sitting in your dining room table, and the first thing that happened is that there was a trigger here, which was a bunch of text messages. Your phone was blowing up, and it sounds like what I hear is that you're saying a lot of things to yourself. So your thoughts started to escalate. You said things like, what am I going to do? How am I going to work? How do I tell my kids this? Right? And it sounds like those thoughts start to spiral pretty quickly. And so if I anchor in one thought, for example, how do I manage, right, my kids and my work? I imagine that created some emotions immediately. What did you feel at that point, Oren?
Yeah, I mean, I just felt incredibly tense. It just I didn't know where to start. I felt kind of confused, like I was starting in the middle of a book and didn't know how to organize everything that needed to be organized in that moment.
So you said two important things here. Sort of the first thing is you feel like tense, right? And then it sounds like your brain actually did one of the indicators of what we talked about earlier. It sort of went blank a little bit, sort of like that sense of confusion, right? I love the picture of like I'm starting in the middle of a book. It's sort of I don't know where to go. And then what did you do as a behavior? What did you actually do to try to sort of deal with this spinning cycle?
Yeah, I mean, I went to my wife right away, communicated it to her. I think she could see the look on my face at that point. And, you know, she thankfully instantly went right to, hey, we're gonna have to structure their day. Like, that's not, like, she was able to, like, go from the very big to the very small pretty quickly. And that helped me, I think, kind of move towards something that I had a little more control over.
Got it. So this is great. Sounds like you went to behavior. You went for social support seeking. You went to your wife and said, listen, I'm spinning here. And maybe in that moment, what I'm hearing and knowing your wife, that she was slightly in a different place. And she said, wait a minute, let's anchor here on what we can actually control. And I imagine that Johanna helping you there actually helped you slow down a little bit that cycle and gave you a little less anxiety. Is that the case, Oren?
Yeah, definitely. I mean, once I started to shrink the problem a little bit, you know, my heart stopped pounding and I felt like I was starting to get into a place where I could talk to my kids about it.
Many of us experience exactly what Oren is talking about. And we really need skills to slow down our brain and to be able to stop those spinning cycles. At Mass General, in our lab at Community Psychiatry Pride, we've designed CBT skills that we have really called TAB, thoughts, emotions, and behaviors. The idea is to move away from therapy, but create sort of a applied skill-based skills that anybody can use anywhere to stop the spinning cycle. We've been testing this for 5 years and really have shown that anybody with no clinical training can learn this. And that's partially why we're doing these webinars, because we want to share some of those skills with you so we can help you break your spinning cycle. One of the skills that we use often when we're teaching TAB to community frontline individuals or to our youth, we use something called the TAB cycle, which is just what I did with Oren, slowing down what's happening. You probably noticed that I said to Oren, wait a minute, there's a lot going on. Tell me first what you're saying to yourself, then what you feel in your body and your emotions, and then what you did about it. By doing that, it really helps us to sort of cool off our brain a little bit. When it comes to our thinking, we talk about exploring thoughts and helping some of those catastrophic thoughts that many of us are having in this moment to get us back to that zone. And we also talk about skills like charging up. How do we help our immune system? How do we activate our bodies at a time that most of us might be shutting down? And many of the webinars that we're going to be doing subsequently will be providing you applied tips on how to use those skills to break your own spinning cycle, get your brain back to the zone, and be able to weather this pandemic the best way possible.
Luana, that was really helpful, super helpful. I mean, the idea of I was having like 10 different thoughts, and just to be able to pull them apart and label those along with my feelings and my actions at that time, like, it definitely slowed me down from spinning. So I think this was a great skill that we could all use right now. And I wonder if you could just help summarize some of the other takeaways from today to help get our community moving again.
Oren, I think there are a few messages that are really important for all of us to remember about the role of anxiety in the midst of this pandemic. The first thing I want all of us to remember is anxiety is expected and adaptive, but only up to a point. And so I really want to remind us to really be kind to each other, because all of us are going to have some level of anxiety, and just saying to go away, it's not going to be helpful right now. I want to remind us that the tipping past the peak performance zone results in anxiety that interferes with our ability to function. And that's what we want to watch for. We want to watch for, okay, when I'm over that zone, and we talked a lot about the indicators of what that looks like. We want to be able to monitor anxiety by use the validated measure like the GAD-7. That helps us understand if we are passing that tipping point. And today, we very quickly, through the interaction between Oren and I, we spend some time labeling the thoughts, emotions, and behaviors, really doing what we're calling the tab cycle to help us stay in the zone. And in our resource page, we'll have a handout to help you practice this at home, to practice starting to label your thoughts, emotions, and behaviors.
Thanks so much, Luana. I'm really looking forward to diving into these skills. And in the meantime, we want to share some other resources with the HMS community that are available to address a lot of the questions that we imagine all of you have right now.
Absolutely. So the resources page will have a lot of HMS specific resources. And what we'll be bringing to you in our second webinar is talking a little bit about what we are all experiencing, which is this desire to be glued to our TV, to our phones, to the media, and what that might be doing to our brain, and really talking about this idea of limiting our news consumption. Why are people telling us that? So we really we spend some time talking about cooling off our brains a little bit. Thank you, everybody, for listening to us, and we hope to hear from you. Please stay connected with us. As we mentioned, we're going to do a series of webinars. We're going to be releasing 2 right away, but we will want to hear from you so that as we are using some of the skills in later webinars, we actually applying to things that our community are facing right now, and we can make it as useful to you as possible. Stay safe.